I think that's our cue. Well, welcome. I'm really pleased to see Safe Streets workers with us today. Glad that for those who can join us in Sheldon Hall in the Bloomberg School of Public Health, and really also excited that we have over 200 folks joining us online for this conversation. My name is Daniel Webster. I'm a professor here, and I'm affiliated with the Johns Hopkins Center for Gun Violence Solutions. Just a very brief overview, what we're going to do today. We're going to first hear about what in the heck Safe Streets is. What do they do? Then, and we're going to introduce you to some of the folks doing that work. I'll share some of our new findings on the effects of Safe Streets on gun violence in the neighborhoods that they work. Then we're going to transition to a panel where we're going to be looking a little bit more forward down the road. What do we hope and need for Safe Streets to continue to be effective in our communities? So that's what we have today. Thank you again for being here. For those of you online who are watching the Orioles game, you can turn that off. They are killing it 8-2. Our focus now is going to be on the other team in orange and black that we should be celebrating today with our Safe Streets brothers and sisters. I want to start a conversation today and introduce the director of the Mayor's Office for Neighborhood Safety and Engagement, Shantae Jackson, who's going to give us a little words of opening about what is the Mayor's Office doing with this program and generally. Going to introduce a site director who will tell us really the ins and outs of how this thing works, and then we'll get on to the research. Shantae, thanks for being with us.
Good afternoon, folks. So many thanks to start us off. First, thank you to Dr. Webster and to Johns Hopkins Hospital for hosting us for this occasion. We appreciate you. Thanks to our CVI partners, LifeBridge Health and Catholic Charities for your continued dedication to this work. And thank you to our Safe Streets workers who will serve as panelists in addition to those who are here as staff members, for just the deep love that you all have for Baltimore City and the ways that you show up and risking your lives to serve on the front lines of this extremely transformative work that you all are doing day in and day out. We are eager to hear from the panelists today about the work that they do from their perspective and why they do what they do for Baltimore. And finally, thank you to everyone who is here in person joining us and those who are joining us virtually. As a former site administrator of a Safe Street site and someone who's been deeply connected to this work for a little bit, even before I took this role on under Mayor Scott, I know firsthand the profound impact that our Safe Streets Baltimore sites have on reducing homicides and non-fatal shootings across Baltimore City. Dr. Webster's evaluation highlights that the program has reduced homicides significantly. I will not steal his thunder, and non-fatal shootings significantly on average since its inception. Our violence interrupters work tirelessly and selflessly to mediate conflicts in our communities and to encourage peace among Baltimoreans of all races, of all faiths, of all creeds. There's a reason why Safe Streets Baltimore's flagship violence intervention program is the foundation of the work that we're doing. As of this past Tuesday, Safe Streets Violence Interrupters have conducted 403 mediations so far. In other words, 403 potential instances of violence were peacefully de-escalated because a trusted, credible member of the community was there to intervene. And I want us to think about that for a second. Let's contextualize it hypothetically. Let's say that only 10% of those incidents would have led to an act of violence. That's still 40 Baltimoreans, 40 villagers, and their loved ones who were spared from harm and trauma and potential loss of life. And that's across only 2.6 square miles of our city. Safe Streets violence interrupters stand on the front lines, literally putting themselves in front of a firearm or another type of weapon to interrupt the transmission of violence in our neighborhoods. Imagine witnessing a conflict and literally putting yourself in front of a weapon in hopes of changing somebody's mind, in hopes of reducing an act of violence being committed in our communities. That takes a true love of your neighbors. That takes a dedication to your community. That takes a deep understanding that Baltimore's greatest asset is its villagers who show up and do this work. For 16 years, almost 2 decades, Safe Streets has been an anchor and literally a lifeline to some communities across our city. But Baltimore hasn't always poured back into this program by taking care of its violence interrupters. This administration is committed to pouring love, support, resources into this program so that we can expand it and deepen our impact that Safe Streets has had and will continue to have, along with other types of community violence intervention work. So I'm not going to talk too much longer. What I will say here is that I am so happy that this moment is finally here. I think it's the first thing that I said to Dr. Webster when I came in. I'm like, it's here. Like, finally, we've been talking about this for some time now. And I'm excited about this moment because it's time for the positive narrative to shine. It's time for your work to be externally validated. It is time for Baltimore to know what the truth is. And so I stand with you today, sit with you today in a couple of minutes, really excited to hear what Dr. Webster and the panelists are going to share. Thank you all. Who am I introducing? Oh, so I was scared. You said David. I'm like, I'm introducing David? You mean Moo, right? Got it. I would offer that for those of you unfamiliar with Safe Streets and how this extended family communicates with each other, there are many times when we don't even know each other's what we call government name, right? And so when he said introduce David, I'm like, who's David? I don't know that I know your last name, David, but I'll gladly introduce David, aka Moo, to you all. He is the site director of the Woodbourne McCabe site, and I'll let him take it over from here.
Hello, everybody. Thank you for having me here today. Appreciate the opportunity to tell you guys a little bit about the work we do here at Safe Streets. My name is David Fitzgerald. Yeah, I've been here at Safe Streets for 11 years now. I'm currently the site director. Safe Streets is a violence prevention and reduction program geared to stop the shootings and homicides in our community by way of mediation. We use a public health approach to deal with gun violence, treat gun violence as a disease, an infectious disease that spreads like an epidemic. The 3 steps to cure epidemic is first, we identify and detect, what's the root, what's the cause. Then we stop the transmission, stop the spread of it. Then we educate the public, mobilize the community to change their thinking norms. Safe Streets employs credible messengers from the catchment zones. Credible messenger is someone from the community that have a good rapport with the highest risk individuals. These messengers are then trained in our model. We collect and analyze data at the beginning and end of each shift, at our briefings and debriefings. We also compare this data with local crime reports to create the best strategy for violence prevention and reduction. Most importantly, we talk to the community to come up with a plan to reduce the shootings and homicides in our communities. We also do shooting responses within 72 hours of a shooting in our catchment area. And our teams work relentlessly with the community and our community partners to reduce shootings and homicides in our community. Thank you guys very much for your time.
Thank you very much. We are going to get into a little bit more of the weeds when we get into the panel discussion about the specifics. It is a public health approach, one that in a school of public health, we're very familiar with all the points that you were making, David, Mumu, whatever you would like to prefer to be called, Director Fitzgerald. And we'll be getting into more details on that in our panel discussion. But the way he describes it, it makes it sound really easy. And we know that's not the case. These men and women are going into some of the most challenged neighborhoods that have suffered from disinvestment, racism, and other problems for many years, and trying to address, Baltimore's biggest problem, a lot on their shoulders. And so, again, deep respect for this work. I'm going to now get into our study, what we did and what we found. I'll first, of course, acknowledge the co-authors on this study, Carla Tilchin, who's with us today and will be a panelist, and Mitch Doucette, our Director of Research Methods at the Center. Very briefly, we've had a history with this program. My own history with the program dates to its inception back in 2007. We've done several studies, and I'll just briefly mention what we have found over those prior studies. 2 outcome studies looking at the same sort of outcomes of homicides and non-fatal shootings in 2010 and 2012 found very favorable, clear, pretty substantial reductions in gun violence in 2 of the 4 sites. A third site was sort of mixed. There was some evidence of protective effects, and another site less so. Again, there were only 4 sites in those earlier days. We've also done anonymous street interviews of youth in Safe Streets neighborhoods versus comparison neighborhoods, found evidence that the program was associated with norms that were less accepting of using guns to settle disputes. And our findings, also, we found some positive effects when we've surveyed program participants of how the program has positively affected their lives. Our findings have helped to secure funding to keep the program going. Our most recent report in 2018 with data through 2017 was less encouraging. We found some deteriorating effects over that time. The current study, we expand with more than 4.5 years of additional data, 6 new sites to study. And we're also employing a new statistical method that we think is far better in terms of the validity and precision of our estimates of program effect. And I'll go over that very briefly now. The data we draw from come from Open Baltimore and Baltimore PD. We're looking at crime incidents as well as, while we're controlling for a variety of things that law enforcement is doing to combat gun violence. We use, as in all of our evaluations, we're trying to we are comparing trends in neighborhoods that adopt and implement safe streets versus communities, similar communities that don't have safe streets. The statistical approach we use is called augmented synthetic controls that we use for each site to come up with our best estimate and best comparison sites for each of those sites when we're forecasting or predicting and estimating program effects. And then we are combining those into an average effect based upon how precise each site's estimate is, because there's different degrees of precision with each site. And then finally, it's worth noting that, and this was the hard part, quite honestly, is knowing sort of when is a site fully staffed. Quite often, they're never fully staffed or not very frequently. We did our best job to estimate when generally it's a fully functioning site. And you don't stand up one of these overnight. This slide just sort of shows you, so in this slide, the pink neighborhood highlighted here is Sandtown Winchester, and the different shades of other colors there reflect a comparison neighborhoods based upon how closely those neighborhoods help you predict trends in gun violence in Sandtown. And it's important to understand that the synthetic control approach is not something that we as researchers can manipulate. This is done by algorithms that minimize any prediction error. So we cannot sort of put our thumb on the scale to make the program look better or worse. This is done with statistical methods. To give you an idea of what this looks like, what you're looking at here is a difference between homicides in Penn North over a span of time and what our model predicted both before and then after the Safe Streets was fully implemented in Penn North in this case. And beforehand, it generally fluctuates around 0. There's no difference. It's a reasonably good prediction. And then most of these data points afterwards show lower levels of homicide than would have been predicted had Safe Streets not been implemented. This slide is simply a similar depiction with a different outcome in a different neighborhood, again showing more of these data points being below 0 after the program was implemented than having higher rates of non-fatal shootings. So when we sum up our data over all the sites and looking at the general patterns, what we see in 8 of the 11 sites, and I'll just note that there are 10 sites now. There's 11 sites in our study because we looked at Mondawmin, which was in place for a long time, and we wanted to learn from their experience. So 8 of the 11 had fewer homicides than would have been predicted had the program not been there. The average effect in the longer running sites was 22% lower levels of homicides. If you just look at the first 4 years, which is the models that we feel like are most valid, we find even a stronger effect of a 32% lower rate of homicides associated with the program. However, in the 6 newer sites, we did not see statistically significant differences yet in homicides. When you looked at non-fatal shootings, we again found in 8 out of 11 lower rates of non-fatal shootings than what have been predicted. When you average across both the longer running sites and newer sites, you get 23% lower rate of non-fatal shootings associated with the program. Because gun violence is incredibly costly, and as strategies to address gun violence go, Safe Streets is a relatively modest investment. The return is quite substantial, depending on how you calculate the cost of a shooting or a homicide, anywhere from $7 to $19 returned for every $1 invested in Safe Streets. These are just a quick snapshot of the neighborhoods and how long Safe Streets was implemented. I'm not going to go through all of them, but just to sort of acknowledge that some have been in place for a very long time and some for a relatively short amount of time. And these affect our estimates as well. When we look at the homicides within each of these neighborhoods in the longer running sites, you see 4 out of the 5 with lower rates of homicides. 3 of those 4 are statistically significant. The 4th one is honestly right on the edge, could have been statistically significant, but one had higher rates of homicides associated with the program. I've already been over the average effects in the prior slide. When we look at non-fatal shootings, we see generally favorable effects. In most of these, the effects going in the expected way. Only statistically significant, however, in Lower Park Heights. When we look at homicides in the newer sites, we have an average of 8% reduction, but that's not statistically significant. Penn North looking most clearly favorable among the newer sites for that outcome. Non-fatal shootings, we see a 19% average effect. 3 of the sites having significant reductions, 1 having a significant increase. I'll highlight that this one estimate for Belvedere is quite sensitive to the model approach. Another modeling approach found elevated rates, but not statistically significant. So there is some sensitivity there's generally consistency across our different models. This is one outcome in one site where that is not the case. Overall conclusions is that Safe Streets has reduced gun violence. The effects, the size of the effects are in line with the recommended evidence-based approaches to reducing gun violence in cities, such as GVRS that's now being implemented in Baltimore, or hotspots police units, similar levels of effects. Drawing upon data from another study that looks at the relationship between the number of police officers and violent crime, to have the same protective effect that Safe Streets has had, you would, if you apply these numbers from the national study, you'd have to hire 10 additional police officers for every single neighborhood to get the same effects that Safe Streets is having. I want to underscore that we did not do an in-depth evaluation of implementation issues. The Mayor's Office for Neighborhood Safety did some examination of that themselves. I just want to acknowledge that over the long period of this time, that there have been staffing issues, there have been pay issues, there have been a lot of gaps in worker training. Not at all your ideal circumstance, yet we're still seeing favorable effects. There is a next phase that we are planning and excited to do in collaboration with the workers and the sites to better understand the conditions and practices that lead to the best outcomes and the challenges they face, to better understand the variability in program effects. I'm going to pause right now and just sort of see if there are questions that folks have about anything we did or any of the data, any of our findings. We do have a microphone if you want to do that. Any questions? Are there any online? No? I was so clear, I guess. Wow. That's actually fantastic because that will give us more time for the next part of our time here, which is our panel discussion. So again, last chance, no other questions about the research? That's fine. I'm going to ask our panelists to come up. Oh, wait, we got one? Okay. Gentleman in the back, we'll get you a microphone so everybody can hear, including online.
I'm gonna tell y'all, Side Town, I'm a VI for Sandtown. I just want just want to know how accurate is your
Estimates?
your estimate, yeah.
Uh-huh. Well, look, I want to acknowledge that trying to model and predict rates of gun violence in a given neighborhood in a given time is not an easy thing to do. We use available data as best that we have based upon rates in other areas of similar neighborhoods, based upon law enforcement measures. But we know we are not measuring everything. And for example, we know that obviously in 2015, we had enormous disruption in our city following the in-custody death of Freddie Gray. That certainly affected the communities you work in and your work, and probably some places more than others. So there's certain things that we try our best to statistically control for, but we know that any given estimate isn't 100% guaranteed accurate. That's why we really focus on the average effect over all of these sites, because some are going to be off in one direction, some might be in the other direction, but we think when we aggregate it all, we're far more confident to show that the program is having beneficial effects. Does that answer your question? Okay, cool. All right, good. Can we, sure, one more. Yeah.
Over what time period were you presenting the statistics that you were showing the averages?
So over the time period the program was in effect, so over the totality, the program was been in place since the summer of 2007. Our data go through the end of July in 2022. We will be updating with more fresh data. And it's important because these newer sites, those estimates we predict are going to change some, because the longer running sites, we have a lot of data. We're far more confident there. The newer sites, this is going to change a little bit as we get more data. So thanks for asking that question.
So you presented a really good ROI for police presence.
Yes.
Mm-hmm. Is this information that's shared with those in the leadership of the police department?
We share everything. So we were making this public, and we were having this event because we want everyone to know about it. Whether that's someone in the mayor's office or the police commissioner or whoever, we hope that these findings will help them understand the problem and make wise decisions about how to address it. Well, let's do one more, because I do want to make sure that we get our panel up here. Is this Alex in the back?
Alex Long, McAlgie Park. Could you just elaborate a little bit more when you were saying for us to get the same desired effects in similar neighborhoods, that it would take like 10 additional officers? Could you just explain that a little bit more?
Sure, yeah. So a large study done by, led by Aaron Shaflin, who's at University of Pennsylvania, looked at data across 232 cities, looking at violent crime rates and a variety of things that might explain changes in violent crime, including the number of police officers employed in any given year in any of those 232 cities. I'm not going to get into the details of the statistical analysis, but when you control for the other factors, it translates into roughly about 10 additional police officers to prevent one homicide. So if you correlate that with, comparison to Safe Streets effects, it means that roughly about 10 officers in one neighborhood to get that effect. And just to be clear, if you're if you guys who do the work know this, but that's a lot more money than what goes into Safe Streets to pay 10 police officers round the clock, right, in those neighborhoods. So it's a different return on investment. And to be clear, obviously, we have law enforcement to do a range of things, not just reduce gun violence. So, but when we're talking about gun violence, this is a pretty darn good return on investment and a healthy, interesting comparison point when you think about law enforcement. Which again, we're not talking about substituting. We're talking about you need a lot to address this problem. And community violence intervention seems to be an incredibly smart investment to lower rates of community gun violence. All right, let's do our panel. Could you please come up now? So we're going to be joined by Freedom Jones from LifeBridge Health and the Center for Hope. We're going to have Kevin Keegan, you can say that, from Catholic Charities. We have Terrence Wooden, who is a violence interrupter in Sandtown. We have my colleague, Carla Tilchin, and we also have Nicole Warren, who is the current site director, right? Did I mess any of this up?
Terrence couldn't make it. We had Antonio.
Oh, okay. So, Antonio, can you introduce yourself, please? Because I didn't get the last minute substitution.
Antonio Stewart.
Okay.
Antonio Stewart.
All right. So what we're going to do here is, by the way, panelists, you just got to push. Oh, and Crystal Miller from Mayor's Office for Neighborhood Safety Engagement. I'm actually going to start with you, Crystal. But I want to tell all of our panelists what you need to do is just sort of hit that button there. And there we go. You got a live mic now, so watch what you say. So we're turning the conversation forward, like what's going on now? What do we need to do, right, to get great outcomes with this program? I'm going to start with Crystal. Crystal, just tell us your role, and very specifically, Director Jackson sort of hinted at some of those things, right? But what is MONSE doing to strengthen this program to get the best outcomes?
Sure. Good evening, everyone. My name is Crystal Miller. I am the Community Violence Intervention Deputy Director for the Mayor's Office of Neighborhood Safety and Engagement. And in my role, I have the esteemed responsibility of building out the Community Violence Intervention, or CVI, ecosystem. And what that means is setting up programs and adding partnerships and really providing some oversight for those programs and partnerships that make up the ecosystem. So we are working collectively and collaboratively to reduce violence and addressing the symptoms that lead to violence, such as poverty, lack of education, if there's mental health or substance abuse issues that individuals need support around. So we have programs that are addressing those needs. And in my role, one of the things that I'm doing with MONSE, as a part of the MONSE team, is looking for ways that we can add to the work that the staff are doing already on a day-to-day basis as Safe Streets employees and members of this community. And that looks like developing training and building out a trajectory for staff to move beyond their current roles, so they're not in the same roles for 5 years, so they can move up into new opportunities. If they want to pursue new career paths, they're able to do that through some of the training that could be pursuing different certifications, if they want to continue their education, and looking for those opportunities and being able to provide support for those opportunities. Making sure staff are adequately and efficiently and effectively trained so they can do their jobs well. So we have a new training for all staff once they are brought on, and they will receive booster trainings. That training is called Intro to Safe Streets, and we just had a booster training for the LifeBridge Health sites to add on to what they've already received at the end part of 2022. We also have set in motion for staff to receive a $5,000 increase from their previous base salary. So all staff All staff who were not yet at that base salary have received that increase and now are at a living wage, and also put a standard for them to receive a cost of living increase every year in their role. So we want to professionalize the work you're doing. You are professionals in the work that you're doing. So we're creating that standard along with your salaries that you receive and the training that you receive. We've developed an operations manual to create some standards around the work and to unify the work that everyone is doing. And it helps with our collective work with our partners who are here at the table with us, with Catholic Charities and LifeBridge Health. So those are some of the things we've done to really put some additional support around the Safe Streets program.
Okay, thank you. And Mumu did a great job of sort of explaining the sort of the nuts and bolts basics of Safe Streets. But the way this works is the city gives contracts to community-based organizations. And right now, the two key organizations who are implementing this program, hiring the workers, providing them supports, are the Center for Hope at LifeBridge Health and Catholic Charities. So I want to hear both from Freedom Jones and Kevin Keegan a little bit about, I want to just sort of acknowledge, like, this is not an easy program to do, okay? Like, any community-based organization can't do this. You have to be really committed to do it. So you put your heart and soul into this. Can you just share a little bit? I'll start with Freedom and then go to Kevin about what you're doing to support this program.
Prayer. Oh, just kidding. First, like Dr. Daniel Webster said, that I am Freedom Jones. I'm the director for all of the community violence intervention programs at the Center for Hope, which is a LifeBridge program. We have 6 Safe Street sites. You know, we are really, really grateful for those sites. We understand that it is a lot of work. We have recently transitioned all of those sites from some really great CBOs to ours, which was really a huge feat. And we didn't do that by ourselves. You know, it was all the guys, you know, it was a lot for you. We understand. It was a lot for our partners with Monsi. But one of the things that we're really, really pleased about is that this is a public health model. And partnering with a hospital, our hospital has 2 hospital responder programs. We have a lot of services that, one, can support the work that Safe Streets does from a trauma-informed availability for participants. 2, we can really, really develop, we're really, really, I am stoked about the fact that we are building something called the Executive Presence Institute. And it's going to be a program where there will be trainings and support of all kinds of stuff for the staff. We want to really provide an opportunity for the staff to understand what it means to get involved in a nonprofit, understand what it means to carry all that trauma with your expertise from the street into the work and develop self-care. So we're going to be partnering with Monsi to really look at what we're offering in that Executive Presence Institute, because we want to work in partnership to be able to help the staff understand what they're carrying into the work so that they can be their best selves in the work. So that's one thing that we know is a real need, to make sure that our staff are whole so that when they go out and do this work, they can be their best selves. So we're happy about that. Yeah. That's something that is really needed. You know, really transitioning, when we're fully staffed, we'll have 58 to 60 men and women on the street. And one of the things that we understand in this work is that having only 2 CBOs allows us to have more concise communication. It allows us to have a coordinated effort. It allows us to have less of the idiosyncrasies that each nonprofit would bring to this work. So the work is more streamlined, and it's really done more precise. So we're excited about that, because we know that's a real need. So that's some of the basics that we're doing. And most importantly, our goal is to really support the staff so that they can be their best selves, and a couple other things. You know, I can talk. We have, you know, because we're a huge institution, we have programs in-house, like mental health. We have programs in-house that are job workforce opportunities. In-house, we have mental health. In-house, we have a plethora of programs that one, our teams can utilize for their staff, for the folks that they're trying to work with, and, helps them really extend their reach for the folks that they're trying to serve. So I wanted to share that.
Thank you. So, Kevin, Catholic Charities have been committed to this work. You started in Sandtown, right? The largest, I believe, of the sites. And Catholic Charities obviously been around for a little while. How do you sort of think about and use your other programs and supports in thinking about how Safe Streets fits in to might complement the other things your organization is able to do for communities?
There we go. It's a great question. Thanks, Dr. Webster, and Freedom. Thanks for what you had to say. I appreciate everything you said. Catholic Charities has been around for a minute. We celebrate 100 years this year, and we've been in Sandtown, Greg, 7 years. Yes, 7 years, 2016. So, that was a commitment on our part, kind of coming out of some of the tragedies in Sandtown in West Baltimore after Freddie Gray. And it was a question for Catholic Charities about do we keep working around the violence or do we actually make a commitment to really getting into communities and working directly with the issue of violence. And what I quickly learned, as I probably in some ways naively first just thought we would do this, that I'll never forget that first day of interviews. It was actually 2 days of interviews to bring the Sandtown team on, and it was maybe two of the most exhausting days of my professional life. Only because what I learned that day was what all of the applicants were bringing in terms of their desire to improve the neighborhood. I mean, like what poured out of the men and women we met with over those 2 days was just this passion to change things and to improve the situation in the neighborhood. Just about everyone we interviewed those 2 days was from that neighborhood, was admittedly part of maybe the challenges over the past 30 years or whatever it was. I felt so inspired and yet also committed to needing to bring those other resources from Catholic Charities to not just benefits the people in the community that our staff would then serve, but then how do we also then take care of our staff?
Right.
Because what I heard that day was men and women who'd been through a lot of trauma themselves, for instance, right? And then the work you're doing every day, putting yourself in the situations that were described earlier, re-traumatize and makes it a challenge to be at your best every day when that's your reality. So being, for instance, this year, through the wisdom of our leader at Monsi and great collaboration, we're now bringing behavioral health supports to the table to support all 10 sites where we can educate about trauma. And support our teams every day and be there. And then when tragedies do happen, sadly, around the Safe Streets, to be there also as a crisis response and to support people in the midst of that crisis and faces coming in to support through those crises. So I'm thrilled to be able to then bring that large behavioral health work that we have at Catholic Charities also then into the fold with Safe Streets. And then I look at the workforce development that we do down at our Daily Bread Employment Center, for instance, and Christopher's Place, which is a reentry program. And I mean, honestly, we have individuals that work for us who've been through our Christopher's Place Employment Academy. And so I think bringing that, the other thing I think you can do as a CBO for the city, kind of in partnership. It's hard to work for the city. For those that don't know that, we love to complain about city government, right? But if you've ever worked in city government, those challenges are not fake, and they're very real. And you have critics everywhere. So as a good partner,
as much as we love our city employees,
we do. But we love to complain about them too. And but we as CBOs, if we are good at what we do can be that partner that can be more nimble, that can be more responsive, that can be, be the one out front helping to get the work done, because we're a little bit more barrier free, not always, but frequently fewer barriers in our way to, especially that, I love that word nimble, to be nimble and responsive in a moment's notice. So I could go on and on about things, but those.
But I'm not going to let you. I want to hear from our site director,
Please.
Nicole, for Sandtown. And we've heard what Monsi and your CBOs are doing and their vision. Your responsibility day in, day out, right, is get this work done, support the work. Can you give us some insight to sort of what that is like and what's most important from your perspective in terms of what is needed, what are the necessary things to keep this program strong and working well? What do you think is the critical piece? What's the magic, right, that you do as a leader for these individuals tackling such a challenging problem?
Hi, everybody doing? My name is Nicole Warren, Director for Safe Streets Baltimore. On a daily basis, would have to be done, not just with our site, with all the sites. It have to be bonded. You gotta have the trust with your team, where knows everybody on the same page, you're working together, you're moving together. And you gotta get trainings for them, as Crystal just said. My day, I got to oversee the VPC, the site director. But y'all need to know I just been director for 2 months, right? And thank you. And I had to split myself in half because we're short staffed. So I do VI, I do supervisor, and I do director. I don't have a problem with it because each role I play in each position, I'm going to be great because I'm going to find something else that they need. And I'm going to bring it to the team. Look, boy, in VI position, this is what they need. Supervisor position, this is what they need. Or VPC position, this is what they need. And we'll all come together as a group and, make the right decision or the right things to do. But it's like I'm learning some stuff. I've been studying on some stuff because I'm all over the place right now, but I'm okay being all over the place. I'm all right. Because if I wasn't, I call on somebody and he know who I'm talking about. And the director that was before me, I'm glad that he had the patience that he had with me to show me some stuff, some things I just looked into on my own, coming into a new position, but I know once everything's settled out and the whole site be full, I'll be able to really sit down and really move forward on some stuff.
Thank you for sharing your story. And it really does underscore how understaffed and stretched the program is to address such a serious problem when you're covering so many bases while leading this effort. I want to now turn to our violence interrupter. And if you could maybe shed a little light upon, because when you think about this job of you're going to go in and try to talk someone out of a shooting. What does that look like? How do you do that? What are the keys? Can you give us some insights on that?
How y'all doing? My name is Antonio, and I'm a violence interrupter at Park Heights. And what I do is, being as though I've been at Park Heights for 40 years, since I was 12, and I'll be 52 this year. So I know everybody and what's going on up there. So I canvass my neighborhood from the bottom to the top. And I got 5, maybe 6 high-risk individuals that I know about that, about the street. So I got their number and my phone, and they got my number, so I call them, they call me. But, what we do is we at 3:30, we might clock in at 4 o'clock. By 4 o'clock, we briefing, meaning that it might be 'cause we understaffed too, so it might be 4 or 5 of us there, but we sitting down at the table how it is now, and I might tell them what's going on in the neighborhood, because I got probably like my post is probably like five to six different streets, maybe more, because I canvass from the bottom to the top of Park. That's just because. Like I said, we sit down, we brief, we let everybody know what's going on the blocks or on your block, see if there's any trouble, and then like on the debriefing, we'll do the same thing like at the end of the night. So where though always know what's going on, but this is what I do. Like I said, I call my individual every day to see how they doing, check their temperatures, see what's going on with them, and they call me the same thing. So if something happens, dully speaking, if something happened up the top of Park Heights and I'm at the bottom, and we got violent interrupters up there, so I try to call up there, and he'll get his name, I'll get his name. We'll try to sit him down at the table and try to squash it before it happened. Now, if it happened already, and it's already bloodshed, then we'll go to the people's house, the mother house who lost her son, see if we can be any assistance to them, and you know what I mean, see if they need any type of help or any type of way. But that's what I do. You know what I'm saying? I just canvass Park Heights from the bottom to the top, and you know, and I just stay in my high risk people in and just try to tell them it's a different way besides being outside. And you know, doing it really before Safe Streets, because I lost 2 kids in the streets, a daughter and a son. So I'm really passionate to this. You know what I'm saying? So I'm really trying to change the norm, and that's what I do.
Well, Antonio, we appreciate what you do. What a challenging job, and you obviously do it with great passion. I said I wanted to sort of look forward a little bit too. So last panelist, Carla Tilchin, we have some plans, you have some plans, right, for next phase of research. Can you just sort of brief us on the thinking, what that's going to look like and why that's important?
Yeah, absolutely. So we've been talking a lot about worker support tonight, and that is definitely going to be a central component of what we're going to look into moving forward, knowing that that's an absolutely critical part of the program's success. And in addition to that, we want to learn a lot more about what's underlying some of these differences we're seeing across sites in terms of what contextual factors or neighborhood factors may be going on to explain some of those differences. Safe Streets is built on a model that was developed over 20 years ago, and we know a lot has changed in terms of gun access, social media, and the violence dynamics themselves. And the workers who are on the front lines doing this work day in, day out are the ones that have the knowledge and the expertise of how we need to think about the model moving forward, both holistically and also sort of thinking about specifics within the sites and some of those dynamics. So we're really excited to spend a lot of time with the staff to really learn from them and sort of collectively elevate all the expertise that they have gained in order to inform program implementation and investment in a really strategic way moving forward.
Great, thank you. I'm so excited about this next phase because it is really important. Look, the quantitative analysis is really central to understanding program impacts, but there's always so much more you learn by combining the quantitative data with the kind of analysis that Carla's planning on leading, and I'll be helping supervise that. I now have a pad with questions that people are sending in from who are online joining us, but if someone has a question for a panelist now in person, I'd like to give you an opportunity to yes.
Good evening. I'm Angela with the Bloomberg site, but I first want to thank the panelists for your passion, your expertise that you're sharing with us today, and the work that you're doing. Oh, can everyone hear me?
Yeah,
so my question is actually for Catholic Charities. I wanted them to share with us how do you foresee the intergenerational center that you guys are building over West Baltimore kind of working with the community violence intervention programs, and how do you see that benefiting the community?
So the intergenerational center that's coming in a couple years, I wish I had more answers for you about it right now, except what I do know of the intergenerational center is that the intent will be to have multiple different programs, everything from Head Start, through adult supports, through the whole gamut, co-located at the same site. And, it's hard for me to imagine that there wouldn't also be a violence interruption component, kind of filtered through that as well. But there's a lot to be done. We don't actually own the building yet. I mean, literally, we're in the process of building it. But that's a great question, and if you want, please be involved. I mean, and we'll be involved with you.
So, yeah, you got one more, and then we're going to go online. And then when you're done, I want you to pass that mic to Director Jackson because I have a question for her.
Nick Wilson, Center for American Progress. I have a question for Freedom. First of all, thank you so much for your dedication to this for a long time. My question is, we're seeing a lot of cities like Baltimore that see a lot of racial disparities in incarceration and arrests, especially for simple gun possession, leading towards more programs that do alternatives to incarceration. I was wondering, though, Center for Hope recently testified in favor of Ivan Bates' bill to increase the minimums for 5 years for people just carrying a gun for simple possession, not using it. Do you think those kind of incarceral approaches by the organization will make it harder for the wonderful people on the ground behind us to build those relationships?
Wow.
I'm glad Nick asked the easy question.
Yeah, that's
Nick always asks the easy questions.
I wish you'd repeat that a little bit because I want to dissect it just a little bit, okay? So could you be a little bit more specific?
Sure. We know that a lot of people in our communities and in cities around the country, like Baltimore, they don't feel protected by the police, and they feel like they might need to carry a weapon for defense, but don't have an intention of doing it, and not the ones that are driving the violence that are seen. But there's a new piece of legislation that our new prosecutor is pushing to increase the penalties for simple gun possession, where they'll spend 5 years in prison and away from their communities, as far away from Baltimore as possible. And I was, a lot of time there's this conversation about, should CVI programs like Safe Streets cooperate with the police at all, or should there be this fine line? And so I was just wondering if people like LifeBridge working with prosecutors to increase the penalties for the people that
Well, it's interesting because I think that on a personal level, I have certain feelings about, certain laws that pass because I understand systemic racism. When I was in New York years ago, there were the Rockefeller laws, and the Rockefeller laws really hurt a lot of people of color. And so I have personal feelings. What I do know that, there's probably going to be some good and some bad. But I do think it's important that legislation is passed. So time will tell about that. What I do know is that Center for Hope LifeBridge went to arms to get the Senate Bill 305 passed, which will help us, provide professionalism for the staff, to leverage, training for the staff. So there's mixed feelings. I think what we are doing, even at a Safe Streets level, is helping our teams understand through our executive presence systemic racism. Okay, until people understand the playing field that they're in, they cannot take ownership for their own choices. And so I think activism at all levels is something that we should encourage people to understand. So I hope I answered your question.
Okay.
I probably have some more feelings about it, but this.
All right. Thank you. So last question, I think we sadly, there's many and we just simply don't have time. There are several questions that have come in that sort of in generally are asking like, how does Safe Streets or the mayor's office decide which neighborhood is going to get it, whether you're going into schools, are you expanding? Can we make this 24/7? One question was, is this a 24/7 thing? No, it's not. There's only so many hours and limited human resources going in. So, Director Jackson, what's your general thinking about program expansion, recognizing that the need is great in Baltimore?
So I think Crystal touched, and thanks to whomever submitted the question, I think Crystal touched on this a bit when she started talking about the evolution of the CVI ecosystem. I think all of the orange shirts in this room know that Safe Streets will forever be our flagship program. And there are a host of other community-based organizations that are doing community violence intervention work, whether we're talking about interruption in the moment, victim services, wraparound supports, mental health supports, crisis. So we're looking to make sure that we are extending Safe Streets' reach by reaching into those community-based organizations. More specifically about the expansion of Safe Streets, always been really clear from the very beginning that we needed to come in and understand what was working and what wasn't working before we had conversations about expansion.
Okay.
We've completed that, right? So we've done this internal assessment, and thanks to the academic assessment, we now have what I would consider compounded information associated with what it would take to expand the sites. But we're well on our way into having discussions about what that looks like in the coming years.
Okay, I am afraid we have to end this conversation. It's sad because there's so much talent and passion and great ideas up here on our panel, and so much with us right in Sheldon Hall here. Thank you, everyone, for coming for this, for the work you do. Thanks for joining us online. If you're with us here, I hope you'll spend a few minutes. We're going to have a little reception right outside here. People can direct you. And again, great work, everyone. Thank you.